You're listening to a Raconteur Studios podcast.
Hello and welcome to the After Hours Skin Clinic. I'm Dr. Emma Craythorne, a consultant dermatologist, here to give you expert-based, evidence answers to the skincare question that everyone's asking. The stuff I get asked after hours, at the school gates, on a walk in the park, or over a glass of wine. One of our lovely listeners, Bryony, has sent in some questions about caring for your baby's skin, so we thought we would do an entire episode on this subject. Before we get into this episode, if you like what we're doing here at the After Hours Skin Clinic, then please give us a follow and share this episode with some of your friends and family. It really helps people to find us. And remember, we love receiving your questions, so keep those coming in. Anyway, enough of that and on with the episode. Today, I'm with my lovely co-host, Dr. Ellie Rashid, and she's back with me. Hi, Ellie.
Hello.
We'll be covering the key differences that there is between baby skin and adult skin, and we'll be thinking about some of those common episodes that people see in their babies, the way that they present, and also really how to care and look after your baby's very precious skin barrier. So I've actually just had to write a chapter for a book on the differences between baby skin and adult skin. And it's one of these things that unless you really dive deep into it, you're not really sure of what those differences are. But should we get into that first of all?
Yeah, perfect.
Yeah. So what do you notice as the key differences between babies and adult skin?
So baby skin is thinner than adult skin, and the top layer of their skin is not yet fully developed. And so they have more of this transepidermal water loss. So they lose more water from the surface of their skin. Then they don't have as many sort of fats and ceramides and things within their skin structure to hold on to water. And because they've got an immature skin barrier, they're also prone to getting more irritation from external chemicals or preservatives or fragrance ingredients than adult skin might be.
And I think as well is that's so key about that lovely creamy stuff that a baby's covered in whenever they first come out. This vernix caseosa, or kind of like a cheesy material, is essentially what it is. Do you remember your babies coming out covered in that?
Covered in it. And you just have to leave it there.
And you just have to leave it there?
Yeah, you just have to leave it. The temptation is to just clean it off, but you just have to leave it be.
I think even with my first child, I thought, I have to clean this off. But then by the time it got to my third child, I think I kept it on, I'd say, for as long as I could. I didn't think I bathed Rory until he was probably about 3 days old.
Well, there are so many cultural differences. So the World Health Organization, they normally recommend that you bathe your baby about 6 hours after birth.
Yeah, they say keep that on for at least 6 hours, and actually ideally 12 if you can.
I didn't wash either of my children until a few days down the line. And even then it was like a really gentle, I wanted to keep that coating on for as long as possible.
Because it's really been designed for two reasons, has it? This white coating, it's been designed to help them slip out of the birth canal with a bit of ease, and designed to protect them whenever they're inside the uterus or inside the womb from all the water that's around.
Yeah.
But then also, whenever they're born, like you say, they lose so much water from their skin, much more than an adult would do, or even a grown child. And so that essentially kind of protects it.
Yeah, I see it as their little shield, their little protective shield. Just leave it be. You don't need to pick it off or clean it off. Just let it be.
And it does something as well by encouraging the right kind of bacteria to grow. So obviously when you're first born, you come from this very sterile environment. And actually, whenever we think about our skin cells, so much of what's on the surface of our body is actually not even our cells at all. They're these microorganisms, bacteria, viruses. And those initial moments when the baby is born is when it first starts to be colonized by the bacteria of the world. And that lovely vernix caseosa really helps to encourage the right kind of bacteria to settle in place, doesn't it?
Yeah, it's another key difference, isn't it, between baby skin and adult skin. That microbiome, the environment of things that live on our skin is completely different. And their immune system's developing, and so much of our skin is about our immune cells that sit there. So it is completely different, needs to be handled differently compared to how you'd handle adult skin.
And that microbiome is so important in a baby's skin, isn't it? Like how that's developing and how it's protecting it from the outside world.
Yeah, and when we think about like washing a baby's skin, you want to be able to use things that are really gentle, just whilst they're developing their own little ecosystem that's going to protect them in the long term. You want that ecosystem to flourish as well as possible without constantly stripping it with some of these ingredients that we wouldn't normally use on a baby.
I remember whenever I was younger having lots of bubbly baths. Did your mum bath you in bubble baths whenever you were younger?
It was like the thing. Absolutely. You go and choose your bubble bath.
Whereas now you would not dream of using a bubble bath that had, say, some of the SLS chemicals in it. You just wouldn't even dream of doing that for stripping out a baby's skin.
What did you use to cleanse your baby's skin?
So for Florence, who's now 16, that was at a time where I really just wanted everything to smell quite nice. And I used lots of the Burt's Bees, lovely smelling chemicals on her. And she very quickly got eczema. And so I then had to, think like a dermatologist and not the mother, and realize that actually all those lovely smelling fragrances were really for my benefit.
Completely.
And not for her benefit.
Yeah, it was a lovely experience for you.
It was a lovely experience until she started waking me in the night crying with her eczema. And so I very then quickly realized that skincare was actually about her skincare and not my kind of sensuous needs. So I then swapped over and I actually used Aveeno. And I used to get Aveeno from Walgreens in the USA because I loved this formulation that they did that was called Aveeno Eczema Baby Therapy. And you couldn't get it in the UK. I think they've since made one of the formulas quite similar, but you just couldn't get this one. And so we used to ship it over. And actually, we then used to advise our patients in clinic as well to be using this one. So yeah, I swapped and I used all of the Aveeno products. And then by the time it got to Rory, he was just washed in water pretty much. And then he again had the same kind of Aveeno products, or the La Roche-Posay Lipicard Balm. What about you?
Yeah, so with water initially when they're newborn pretty much. And then I use the La Roche-Posay, the Lipicard, but the cleansing oil. It does make them slippery, but you can get those lovely little baths where they sort of like rest against it.
Yeah.
I think it's called Angel Baby Bath. And so that you can just put them against it and actually cleanse them with the cleansing oil, and it's lovely, doesn't irritate, safe to use from newborns. Perfect.
Yeah. I think that is the thing, is that there's so much fragrance added because it is to give that lovely smell that everyone expects a nursery to smell of. I mean, even Vaseline, if you look for the baby Vaseline, it has a fragrance in it, whereas lots of the adult Vaseline doesn't have a fragrance in it.
Yeah, all the Johnson's baby stuff.
Yeah. Yeah, and it's really it's not necessary. So as a dermatologist, it's very easy for me to say, oh, you just must buy the very boring things. And I found that hard as a mother because I wanted to have that loveliness. But actually, to my detriment, because actually my eldest child did have eczema, and whether that was because I was using the wrong products probably had quite a lot to do with it.
Oh no, I'm sure she would have developed eczema anyway. Maybe it just got there a bit more quickly.
But what was also interesting was at the time where she was a tiny baby with her eczema, I was also working in the hospital as a trainee dermatologist, and I was working in pediatric dermatology at the time. And that was whenever the LEAP study was being conducted. And so the LEAP study is a study that essentially recognized that there were an increase in allergies, particularly peanut allergies. That's what the main focus of this study was. And it wanted to try and identify whether children who had eczema could be prevented from getting a peanut allergy if they were going to get one by eating the peanuts. So I was part of recruiting patients for that study, the learning early about peanut allergy. And this study came around really because, as you know, there's been a huge increase in people who are allergic to peanuts over the last few decades. And one of the main kind of drivers of this was that they noticed that Jewish children living in the United Kingdom had a 10 times increase of having a peanut allergy compared to those children who were living in Israel of a very similar descent. And that really is because of the practices of when peanuts were first introduced to the children. And so they decided to look into this to see if this early introduction of a peanut or an allergy protein actually protected that child then later on in life and reduced those incidences of allergy. And so I remember with great interest thinking, oh, I've got a child who has eczema. Maybe I should start integrating peanut paste into her diet really early to see. And obviously at that time, the study results hadn't come out. We were just recruiting. The study was just starting. But it is very interesting to note because the results of that showed that in children who have eczema and in children that potentially even have a slight intolerance of peanuts, and this is in young children under the age of 4, that if you feed them peanuts or a peanut paste early on, then you reduce the risk of them developing a peanut allergy in later life. And that's even showed that for children who already had a little bit of an intolerance to peanuts, by feeding them the peanuts, they also reduced their chance of having an allergy. And they did this by recruiting 640 children, I think it was, dividing those groups into 2, feeding one group the peanuts and one group not the peanuts. And the group that got fed the peanuts, only 1 in 50 developed a peanut allergy. And for those children that were in the group that didn't eat peanuts and they had to avoid them, 1 in 7 of those went on to develop a peanut allergy. So you can see why somebody was quite interested to try and work out whether anything was going on with diet and the development of these allergies. Because if you think now about how many people in our society are allergic to peanuts and the impact that that has, having to carry around EpiPens, the risk of worrying about what you eat at every meal, the risk of death being on your mind, that something like that could happen. And this very simple intervention of introducing these food groups really early can then go on and reduce your risk of developing that allergy in the future.
I find that study so interesting. It was the crisps that they eat in Israel. They have this peanut coated, it's like a what's it, but it's like a peanut coated Cheeto. And so that's the food that babies are given commonly. And so they have a really early introduction to peanuts, but through this like crispy peanut coated crisp thing.
I always then used to get really worried because I would think in this whole idea of avoiding peanuts, where children are not allowed to take peanuts to school and they're not allowed to take peanuts on any school trips
or on airplanes.
Are you actually then reducing exposure for those nursery school kids not getting peanuts because of trying?
Many children, like on the nursery board, so many of the kids at nursery have got multiple allergies.
Yeah.
So if you're exposed to certain allergens via the skin route, so if you have active eczema, it means that your skin barrier isn't working so well. And so if you get a food protein introduced through your skin, your immune cells may accidentally label that food as being something that's harmful. So then when you go to introduce that food via the gut, the immune system then mounts a response to that, and that's an allergic response. And that allergic response can have different degrees, and anaphylaxis, of course, being the most severe form of that allergic response. And so the whole theory is that if you introduce those allergenic foods as early as possible, so when they're weaning onto solids around sort of 6-ish months, then the introduction to your immune system will be through the gut. And often your immune cells will then label that food as being safe. And so then there's less of a risk of you developing an allergy to that specific food. But it sort of goes against everything that you think, because you've got a young baby, you don't want them to have an allergic reaction. It's petrifying. It's really worrying if you don't know how to manage it. And then you're thinking to a 6-month-old, you're going to give them some peanut paste. And you hear the stories of people with significant allergies. And you think, well, if this happens at home, what on earth do I do? And I've even heard of people like driving to like an A&E car park and introducing a food to their baby like on hospital grounds so that they're close to emergency services if they need them. But yeah, I introduced like peanut, coconut, all of that like really early on because I thought the sooner I can introduce it via their gut, the better. But the difficulty is if you've got 2nd or 3rd children. So your eldest is already established on food. And then you've got a young baby, like less than 6 months old, so they've not been weaned yet. And then you have the older child potentially putting all these sticky proteins from food onto the baby's skin and then introducing the protein that way, and their immune system sort of labeling it incorrectly and then mounting a response. So quite a few parents in my NCT group have had that with the second children, where they've got eczema and then they've become allergic to multiple foods.
Shall I tell you a really crazy thing that I did on this note with my eldest? She does know about this. I have told her. My husband's really allergic to dogs, and I was desperate that we could have a dog whenever the kids were older, because I've always grown up with dogs.
Yeah.
And so when we would go to my sister's house or my parents' house or anyone's house who had a dog, I would get Florence as a tiny little baby to just cuddle the dog.
Cuddle.
Just give the dog's head a little lick. Get the proteins off the dog's head.
Give kisses to the doggy.
I didn't go as far as quite feeding the dog hair, but it was kind of close. But as it turned out, she still remained allergic to dogs.
Oh no. Do you have a dog now?
Yeah, but my dog now is one of these hyperallergenic dog breeds that, is bred in a way that nobody can be allergic to. And what actually is quite interesting is that Neil has still stayed allergic to dogs. But Florence, who really couldn't have even gone to someone's house who had a dog, is now not allergic to dogs.
Yeah, she's sort of grown out of it.
Yeah, and I think it's because we've had Teddy and had him for the last 4 or 5 years that she can now, maybe there was little tiny bits of protein that she was getting exposed to, so something in a similar kind of way. But yeah, now she's not allergic to dogs. So
Thank goodness.
She just got a dog earlier.
Yeah, straight away. Neil, you'll be fine. Stay in the other room.
What advice do you give then in clinic of how people should moisturise their baby's skin?
So the advice has changed. So there are a few pilot studies that were done in the UK and in Japan. And essentially these pilot studies showed that by moisturising your children early, you can reduce their risk of developing eczema later on. And so whenever there's a small study that shows something like that, you have to go on to do a larger study, normally a randomized controlled trial, to then further interrogate that information. So the BEEP study is the Barrier Enhancement for Eczema Prevention study. So this is a study taking 1,394 babies. They had to be term babies born after 37 weeks, and they had to have an increased risk of developing eczema. So that was either a first degree relative having eczema, asthma, or hay fever, and one of these atopic conditions. And then they were randomized into a group that was given an emollient or not given an emollient. And so in the emollient group, they had the choice of either using double base gel or dipro-based cream. And then in the group that wasn't giving the moisturizer, they then looked at whether the children that were given the moisturizer versus the one that weren't given the moisturizer had less of a risk or more of a risk of developing eczema. And actually looking at the children at the 2-year mark, which was the final endpoint of the study, there was pretty much no difference between the two groups in the development of eczema. And so
that might have been about the emollients they picked. Sorry, dipro-base, and what was the other one? Double base.
So based on this large study, and actually a few more studies have come out to confirm that, the advice now isn't to moisturize your children in order to prevent or reduce that risk of developing eczema. You should moisturize your children because their skin looks dry. You should moisturize them because they might already have developed eczema, or for any other reason, if you just want to, for their skin to be more smooth and hydrated, but not to do it necessarily to try and prevent eczema from developing. So to moisturize a baby, you normally would do it in one direction, usually from an up to down direction, not in sort of circular motions. I don't use any emollients or anything that has fragrance chemicals, anything that has any sort of food. Like I don't like using a coconut oil or an olive oil or like an avocado or any of those sort of food oil-based ingredients in it, just because of what we've been talking about. You're sort of introducing a protein via the skin and the immune system could mislabel it.
I know, because I was worried initially about that with the Aveeno, because obviously oat is a protein and you could be allergic to that, but that protein has actually been removed, so that's why Aveeno is safe to use.
Yeah, so I do moisturize my children, and just because when they come out of the shower, I like their skin to be soft and well hydrated, and they do get dry skin, so I definitely want them to be well moisturized. But you just need to be careful in which product you're choosing and then the way you're applying it. So if you're doing it in a really sort of haphazard circular motion, you can increase their risk of folliculitis. They can get irritation. So you just want to do it in one direction, even in the trial, actually in the beet trial, they would moisturize once per day, but if they'd had a bath or anything, they would have to moisturize again. Because conversely, when you have a bath, you actually lose quite a lot of water, and the longer your bath, the more water you're going to lose. So when you come out of bath, you should always try and put a layer of moisturizer on after that.
So you've got a newborn baby. What would be your advice of how often you should bath it, how long you should bath it for, what the water temperature's like, and do you moisturize after?
Yeah, so I normally advise a bath every other day. You don't have to do it every single day, but every other day. I normally advise to keep the bath to within about 5 to 10 minutes, so not necessarily more than that. And then the water, I normally measure the temperature of the water. I just keep the water at 37 degrees.
One of Bryony's specific questions actually relates to cradle cap, although I like how she's framed it. And she has said that her little baby has developed a fromage fringe. I love that. He has a slight cheesiness to the fringe. Yeah. Then when it goes on to develop some redness and crustiness around her ears and eyebrows, she has Googled and she thinks that this is cradle cap or a seborrheic dermatitis, and it looks quite sore. So what is your advice on this?
So cradle cap is so common. It's a form of seborrheic dermatitis. We don't quite know exactly why people develop it, but we think it might have something to do with the role of maternal hormones on the oil glands that we have on our scalp and on our forehead and sometimes around the middle of the face. And you do develop this sort of yellowy, waxy, greasy looking, scaly, sometimes with a bit of a red base to it on those areas. And people don't like the appearance of it, but reassuringly, it often causes absolutely zero bother to the baby. Like the baby is not bothered by it. It's normally we're more bothered by the appearance of it and how it looks. And then there's a role of the yeast that lives on our skin. So this Malassezia yeast that lives on our skin as well. The advice is that you should try not to pick the scale, just because when you pick the scale, you can take some of the little fragile hairs off with it. And babies will always sort of have a little bit of hair loss when they're first born. Like they have a little transient, what's called telogen effluvium, where they have a bit of hair shedding. And so you don't want to then pick off more of this scale and like affect the hairs even more than that. And sometimes you can hurt them by trying to pick off their scale, and they've got their soft little fontanelles and their skin is so soft and delicate.
Did you ever pick your baby's? Yeah, of course. I was like, I love this advice. I picked all of my...
but it honestly, I could not stop. And my mum was always like, Ellie, just leave it alone. But I there is something about it. So
you convince yourself that you can just do it with great ease anyway. It's fine.
And you convince yourself I'm a dermatologist. I'm the most skilled person to be able to do this. So I can do it. You can't, however.
So the advice is not to pick it off, no matter how tempting.
But you can just like put a soak over it. So like a thick emollient, something like an Epiderm ointment or a Hydromel ointment, just to very gently lift that scale. And then when you're very gently shampooing your baby's scalp, then some of it will just lift off automatically. And you can get these really soft little scalp brushes that you can use just to slightly encourage it to come off.
And so what I did, which is against the advice and guidance, is I did soak their heads in the kind of like a Vaseline to really soften it. And then that really does start to lift it away. And this is what we do in dermatology whenever we're trying to take crusts and scale off big wounds, leave it to soak, or trying to get, difficult stitches out of the skin if they've been left out. Just leave it to soak for a while, and then it's a bit easier to pick it off. Obviously, don't pick it off.
Of course, don't. Unless you're a qualified consultant dermatologist.
I think my mum picked it off as well. I mean, I used to see her come around and looking after the kids, and she'd be like, all right, just going to have a little pick at this. And I think the redness that she's describing is probably a little bit of just the skin's reaction to the scale being in place, and maybe a little bit of a reaction to the Malassezia, this little yeast that sits there. So I would say if it's going red, that's probably a little bit more problematic than just having the scale there by itself. Would you not say?
It's a more reason to ease it off.
Yes.
To try and lift it off gradually and safely.
So she did buy a little brush to take it off. So I think that's the advice that you've given as well, that that's okay to, but you can't even use a brush to like rub it really hard to get it off. No. It has to be done really gently.
No. And once it's softened, once you put really thick Vaseline-y, ointment-y emollient over the top of it, and then you can very gently just encourage it to lift off, basically. There is a role if it's very severe, if it's really extensive, then under the advice of your GP, then sometimes we can use an antifungal, anti-inflammatory shampoo to try and help ease it off, or a very mild steroid-based shampoo. But otherwise, just leave it on. It will very gently lift off over the course of weeks to very many months. And in some people, it sort of remains for the first couple of years of their life, but then their hair grows and you can't see it, so no one's bothered about it.
Yeah, and then they become teenagers and then it's problematic again, but this time it's just a lot of dandruff. So Bryony's worried, but because she's seen it in some of her friends' babies, that it's gone on to cover the entire scalp and it's got a bit thick, and then the hairs have got trapped in it. So there's been a little bit of hair loss because of that.
Yeah, so you want to sort of ease it off and gently lift it off before it gets to that really thickened degree. Because, yeah, it is problematic once the hairs start to grow through, and they can't grow through because there's all this thick crust there. So, yeah, you want to gently lift it off. And if it's got to that stage, then you probably would use an ingredient to try and help lift it off, like ketoconazole hydrocortisone.
So let's talk now about SPF for babies. So I'm specifically thinking babies, not children. What's the advice?
So the advice is that you should just avoid their exposure to direct sunlight before the age of 6 months. But people then mistake that advice as thinking that you can never put sunscreen on a baby that's less than 6 months old. But if you have a baby that's less than 6 months old and you're going somewhere where you cannot avoid direct sunlight or keeping their skin covered, then you should still use a sunscreen. You absolutely cannot let a baby's immature skin be sunburnt. So yeah, before the age of 6 months, just try and keep them out of direct sunlight, put long clothes on, put UV protective clothing on, put something over the top of the pushchair so that they're not getting direct UV radiation. And just remember, if you're using like a thin muslin, actually some UV can still get through that. So you do need to think about something a little bit thicker that's going to prevent the sun's effect on your baby's skin.
I think that's right, because a lot of people get mixed up and think, oh, it's because they're so toxic and I can't put these toxic chemicals onto my baby. And it's not because of that at all. It's just because the baby really shouldn't be exposed to UV like a child's skin almost, or an adult skin certainly can cope a little bit better with. Babies just really can't. So I think it's important to know it's not because of the toxicity of SPF, because that's not the case. I mean, the thing whenever I'm always asked by a mum, what should I do for babies whenever I'm going on a hot holiday and the rest of the kids are all going to be in the beach or they're going to be swimming. And my advice really is to use those, those full length UPF clothing. Just love it. I always say to get it in a light color, so a pale white color or a pale blue, something like that. Because if you get a darker colored one, that's obviously going to absorb the heat and then the baby will heat up. But I think that is key, because unless the material is thick enough, a lot of UV will actually still get through.
So what sunscreen do you use for your babies, or when they were babies?
So when they were babies, I really liked the Aveeno sun cream. That was the mode I was in, so I used that on the babies. And I also used the La Roche-Posay and Thelios UV Mune. So I used those. They were my kind of go-to. I felt that they were researched enough and from big houses, Johnson & Johnson's and L'Oreal, that I could rely on them for their safety, really, in terms of being able to get rid of that UV radiation and not interacting with the kid's skin. And actually still now, that's what my children would use, either the Ultrist SPF 50 or the La Roche-Posay. They're the two. What about you?
So the La Roche-Posay and Thelios, the Dermo Pediatric spray. I like the one that comes out white, because then you can see it and you can see where you've applied it and which bits you might have missed. Actually, we still use that now. And the Ultrist have got that huge family pack, massive bottle, which is brilliant. Just lasts you for the holiday.
And also for slightly older children, the Ultras do it in a gun form. So if you've got little kids that like to pretend to shoot each other, it's quite fun to use this and get covered in sun cream at the same time. Shall we go through some common conditions that babies get, a kind of quick fire round, and the easiest thing that you can do for it as a parent at home?
Yeah. So probably the commonest thing that most term babies will undergo is they will all look a bit red. And this is called erythema toxicum neonatorum. And that is completely physiological. When they're born, they will be red and then it resolves. So that's the first condition, not to worry about, not to panic. It happens pretty much to all babies.
Another one would be little tiny white bumps appearing, usually on the face, but can also be in the groin area or any areas of folds. And these are tiny little pinpoint white spots, and they're called milia. And it's really because the skin is a little bit immature and bits of keratin get trapped. And these, again, are entirely benign. They will go away by themselves.
Another one is neonatal acne. So this is when neonates will develop these pus-filled spots, red bumps, and sometimes it can be really quite extensive. Most cases will just resolve on their own, but if it's persistent, then there are some ingredients that you can use to try and help resolve the matter. One of the really important things is not to pick neonatal acne, as tempting as it might be. And if it's really severe or if it's persistent and it's not resolving, then see a specialist.
And then another one would be nappy rash. So where you get this almost like a very red, raw appearance to the skin, usually in the folds or sometimes on the buttocks, because of either something that is within the poo as it comes out that's a little bit more harsh on the skin, or the urine, or it might just be that the skin is feeling a little bit more delicate at that time. But this interaction tends to cause an irritation within the skin, and usually it is this redness. It can be painful. There's a little bit of scale around the edge of it, and that's all about using a good barrier to protect it. I used to love Metanium. That's what I use for my kids' nappy rashes or Bepanthen.
You know, they've stopped it.
I know.
Honestly heartbreaking. And do you know what's so interesting? So that Metanium, the yellow one, was the best for nappy rash. It was my absolute favourite thing to use. And then they had a purple one, which was called their Barrier Everyday. And now they've changed the Barrier Everyday one to yellow. So then a friend of mine was like, it's back in stock. It's everywhere. I've literally just managed to get it at my local Morrison's. I was like, no, it's definitely not around. And then I noticed that they've just changed the colour of the packaging because everyone associated the yellow one with the like treatment for nappy rash, and then the purple one with the everyday sort of moisturizer.
And that was by far and away my favourite.
Best.
And one of the conditions of dermatology that is incredibly common in everyone, but also probably the commonest that we see in little newborns or young babies, is the start of eczema. And it's different to how it presents in older children or adults, because usually in babies, the first presentation is typically on the cheeks. And then that's often a bit confusing because sometimes they also get an irritant dermatitis because of the drool that they get. So the saliva extending onto the cheeks or extending onto the chin can then cause what looks a little bit like an eczema as well. But that is something where, again, the skin needs protected, the barrier needs improved. And usually by using a good barrier over the top of that, or a good moisturizer, can be enough to keep that at bay. So that's a wrap for today's episode of the After Hours Skin Clinic. A special thank you to Bryony, who really was the inspiration for this entire episode today. And if you've got a question you want answering, then please send it in. We want to keep tackling the subjects that mean the most to you. So as always, details of how to get in touch with us are all in the show notes. And if you know someone who's just had a baby or might be interested in this episode, then please don't forget to share it with them. Thank you, Ellie, for joining me today.
Thank you so much.
And thank you, my lovely listener, for joining us. Bye for now. Take care of yourself and your skin. And don't forget your SPF. And see you next time on the After Hours Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.